Free America requires free thinkers only. This is a tutorial on how to read and analyze the news as a free thinker. I'm Tamara Farrow with Women on the Right. So USA Today and other media released the news that Arizona is one of the states with so-called COVID spikes or surges. There is so much to question about how these so-called COVID increases are being characterized, and questioning is the first principle of free thinking. We will get to the USA Today article in a minute to look at the inflammatory and, I believe, unjustifiable language used by these so-called experts related to the increase in cases in Arizona. But first, a quick tutorial on how to digest the news as a free thinker. So, when digesting the news, a free thinker looks for red flags. A free thinker questions, and I know that I have a flurry of questions lined up in my brain, begging for answers as I read this USA Today article. And I toggled away from the article to get some of those answers. Free thinkers don't drink the Kool-Aid, even if it is being served by the so-called experts. It's just not how we roll. So as for the experts, first of all, find out who they are. What is their political or philosophical bent? Who are their associations? It's not hard to find, especially on Twitter, and will help you understand the angle that they're coming from. So this USA Today article reports 1,095 total COVID deaths in Arizona to date, which is in accordance with what the state health department page says. However, they're not indicating a death rate. They're not qualifying the deaths in terms of demographics. I did that here. You'll hear in a moment. And before I share this shocking death rate, I wanted you to know how I arrived at it. I did not measure the death rate as a rate of a percentage of total cases, which is the case fatality rate, because we don't have an accurate picture of total cases, since it is woefully dependent on a currently inconclusive number of total diagnosed. So if you calculate the percentage of deaths based on current case count, it will always appear higher than it is. So rather than do that, I did a per capita death rate, kind of like we do with, say, auto accident deaths in states. So with a population of 7.29 million people in Arizona and 1,095 deaths reported, that leaves us with a whopping per capita death rate of 0.00015%. That's right. So now question, what are the demographics and circumstances of the 1,095 reported deaths? As of June 10th, according to the Arizona Department of Health Services, 841 of these deaths, that is 77% of them, are in the 65 and above age category. But still, we don't know how many of these 77% had pre-existing conditions. But based on the pattern of the data that we have seen around the country throughout this COVID journey, it's safe to say that a strong percentage of these folks had pre-existing conditions. I would also like to know what specific age group carried the bulk of the 841 in the 65 plus category. Was it 70 plus years, 75 plus years? I don't see that information on the state website, but it would be very important to know, particularly since public health officials are blanketing the entire population with these onerous restrictions indiscriminately. So how many of these 841, comprising the 77% of the deaths in the 65 plus category, live in long-term care facilities, for example? That would certainly narrow, again, the broad-brushed concerns, quote-unquote, expressed by the guidelines, expressed by the experts, if you will. So let's get into the USA Today article, some of the quotes by experts, and the characterization of the recent so-called spike. So, USA Today states, quote, experts around the country and in Arizona are raising alarms about Arizona's COVID-19 situation because cases and hospitalizations have increased for the past 2 weeks. Okay, that's the baseline. It goes on. Looks like the state is trending upward in a way that is concerning and could need another stay-at-home order to curb the spread. All right, more alarming language. So one expert quoted was Dr. William Hanesh from Harvard University's School of Public Health. He said the increase is alarming. And then he added that there is a crumb of comfort because social distancing is easier in Arizona. Did he really say that? Yes, he did. I'm sorry, I had to throw that in there for fun. He went on to say the state needs to be thinking about how to slow down the disease. Slow it down? How does he know it's better? He offers no data to support his assertion. There are many factors that could have caused the number to increase. An increase in those who are counting or reporting deaths could make that number increase. An increase in the testing for COVID post-mortem, or when a patient enters the hospital and later dies, could cause the increase. So many factors here. Hanesh also offers a reason, seemingly out of thin air, as to why the number has gone up, stating that transmission occurs when people come into contact with others. Well, that's a revelation. But the truth is, there is no evidence that these cases of deaths counted as COVID were caused by people who died from coming into contact with more people. So that's a big red flag. And when Hanesh goes on for the granddaddy of inflammatory language, he says, if states wait too long to act, they're sitting on a kind of powder keg of transmission chains. Now the average reader is really alarmed and afraid. So I would call that fear-mongering. In the article, Banner Health says Arizona is seeing a steady climb and that the, quote, trend is concerning. Another red flag. How do they know it is a trend? They don't give us any information about that. How can they say it's a steady climb? So Dr. Joe Gerald, an associate professor at UA's College of Public Health, says the disease has taken off in America. Really? Wow, that's a big assumption. He continues, when you put these pieces together, they're really worrisome signs that the outbreak has really gained speed and momentum again. So, Joe, what pieces are you putting together? Because you don't tell us. And if you did tell us, how can you prove that those pieces conclusively fit together to drive your statement that the outbreak has gained momentum? So, again, these are the so-called experts. Let's dig into some of the other details cited in the article. So they say, USA Today says intensive care units are filling up. Ventilator use was on the rise. And statewide hospitalizations as of Sunday were at 1,266 inpatients in Arizona with suspected and confirmed COVID-19 cases, unquote. 8,000 of which were in the past 8 days, they said. Wait a minute. Did you say suspected and confirmed? Wow, that's an interesting number. So if suspected is X and confirmed is 10, then we could actually have only 10 new patients. If the bulk of the 1,266 were just suspected, we don't know, they didn't tell us. So they don't provide that detail, they just make the inflammatory assertion. But let's say most of the increase in hospital inpatients in Arizona at 1,266 did test positive for COVID. Again, more questions. Did they present with COVID symptoms? Had they been previously tested for COVID before arriving? Or were they tested for COVID when they arrived? If so, were any of the hospitals using a new testing protocol that would have then made it look like the number of admissions with COVID had increased around the state because they went from not testing to testing, or testing less and then testing more? None of this information is provided. And were the people that tested positive asymptomatic? Did they have pre-existing conditions that actually brought them to the hospital, or was it COVID alone? Again, questions, the questions. See how quickly the expert claims can fall apart? Then USA Today says the percentage of positive tests per week in Arizona increased from 5% a month ago to 6% 3 weeks ago to 9% in 2 weeks ago and 12% last week. Again, what caused the perceived or real increase? Are we comparing apples to apples as we formulate this percentage, or is it apples to oranges? For example, the type of testing that could be used may have changed. The frequency of testing, the availability of testing could all be factors, so we have way too little information to judge whether those increases are real. The flimsy argument being made did slow down the state health department's assistant director. The flimsy argument being made did not slow down the state health department's assistant director, who came out with a decree for an across-the-board stricter mask policy, urging people to take precautions such as wearing a mask in public and staying at home when sick. I agree, stay home when you are sick, but I'm so sorry, but my informed opinion is that a 4-year-old or almost any child or a healthy person, especially outside, when they're outside and not in the high-risk category, does not need to wear a mask. So, Dr. Casey Ernst, an infectious disease epidemiologist at the University of Arizona, said, if we continue on this trajectory, and it is not just due to 1 or 2 localized outbreaks, then we may need to gear up for increasing action. What action? Is she talking about contact tracing, invading our privacy, forced vaccination against our personal will, that we can't refuse vaccinations? They want to force what they put into our bodies for something that isn't even threatening, frankly. So according to Twitter, Dr. Ernst is into climate change, so I guess we can consider the source. Finally, even New York Governor Cuomo chimed in on the state of COVID in Arizona, calling it a cautionary tale. So to wrap up this tutorial on digesting the news as a critical and free thinker, let's turn to what Governor Ducey said, the governor of Arizona, about all of this. Governor Ducey's office has repeatedly pointed to an increase in testing as the cause of an increase in numbers. Wow, that's all it is? All these dire warnings and predictions and recommendations by the so-called experts to further infringe on our rights, and the governor's assessment is plain and simple. Frankly, I trust the governor. The public health dictates are out of control and overboard at this state of the so-called pandemic. This ability, their ability to dictate to us, is based on a state's declaration of emergency, and these declarations were predicated upon COVID being declared a pandemic. So now, more than ever, we need to admit that the so-called pandemic is likely over, just like they are in Italy and other European nations. Declaring public health to get back to enjoying life and liberty is our right. We need to let them know that. And that we want to take risks. It's our own personal choice to take risks. So if you prefer to stay safe and stay at home and wear a mask, please do. But don't feel that everyone else has to do the same. And now, as you read and listen to the news, before you ever swallow hook, line, and sinker this subjective assessment of so-called experts, be a free thinker and do some research first.